Well, with revised guidelines surrounding some of the most important health screenings for women, the annual gynecological exam has changed. It has been challenging to cut through the tangle of tests women need and when they need them. Joining me now to help create a roadmap to follow, especially this month during Cervical Health Awareness Month, is nurse Barb, Dehn, a well-known women's nurse practitioner. Thank you for joining me today.
Oh, Makiba, it's great to be here, and thanks for covering this important topic.
Oh, absolutely. Now, first, Nurse Barb, how have changes to screening guidelines changed what women can expect when they have their annual exam?
You know, I know that most women expect to have a Pap test during their annual exam, and they expect to have a Pap smear every single year. And what many of my patients are surprised to learn is they may not need a Pap smear every year. And another big change is that for women over 30, it may be recommended that they have a Pap test plus an HPV test together.
Oh, wow, that's good information to know. Now, why is cervical cancer screening so important, and why is the HPV testing recommended in addition to the Pap for these women?
Well, we know that virtually all cases of cervical cancer are caused by HPV, or human papillomavirus. And as research has evolved, we've also evolved how we screen for cervical cancer, because regular screening leads to early detection, and that helps save lives. And so what we've learned is that by combining the Pap test plus the HPV test together, we can find more cervical cancer and more pre-cancer than we could find with either test alone.
Well, that is good for women. And with these changes in the guidelines, should women still see their healthcare provider every year?
Absolutely. Women still need to see their healthcare providers every year because health is head to toe and everything in between. And it's really good to start a dialogue with your healthcare provider about all of your health concerns. And I want to urge women, if you haven't been to see your healthcare provider in the last year, do call and make an appointment because it could save your life.
Yes, absolutely. Now, Nurse Barb, do you have any tips for women on how they can talk to their health provider regarding these important screenings?
Makiba, I'm so glad you asked. So I encourage all of my patients to do 3 things. Number 1, do your research ahead of time and make a list of questions and concerns so that we can start that dialogue or continue that dialogue about your health and the things that are important to you. Secondly, talk to your healthcare provider about what screening tests you need and how often you need to have them. And lastly, do ask your provider about whether the Pap test plus HPV test together is appropriate for you.
Those are wonderful tips. And I'm wondering, Nurse Barb, where can women go to find out more about the important cancer screenings that they need?
Well, for more information, women can go to papplushpv.com, and that's all spelled out, papplushpv.com.
Thank you so much for that. And as Nurse Barb said, for more information and resources to help you navigate through cervical cancer screening and more tips on how to add that discussion with your healthcare provider, visit www.papplushpv.com. Thank you so much, Nurse Barb. It's been a pleasure.
Oh, Makiba, thank you so much. Remember, early detection helps save lives.
Absolutely. Thank you again. Have a wonderful day.
You too. Be well.